Welcome friends. I am Dr. Vasudev Rawal. I have been working as a teacher in the community medicine since last about 40 years. My work has been in the classrooms, in the field, in the centers where the public health activities are going on. And based on that experience, I try to share my experience and whatever I have known to the students. But as on today, the colleges have been shut down because of the lockdown. The students are in their homes. And as a teacher, I thought that why shouldn't I start some innovation? Actually, this is new for me. My generation is that of the teachers who had been talking with the chalk and talk in the classrooms. But what is going on, I'm trying to learn and put into the experience as far as it is possible. A new innovation, a concept is VICHAR, VICHAR. Today, we shall start with that initiative. V for Vasudeva's Institution of Comprehensive Health and Research. This is only a concept, this is an idea. And ideas may grow into some big thing we do not know. But currently, the first objective is to reach to the students who want to learn community medicine. I shall be talking to you in a series of lectures. If you are very comfortable, we can change the schedule from weekly to twice a week or thrice a week. Today, generally when we start, we pray the Almighty, the Goddess Saraswati, the Lord Ganesha, to make this venture successful. Not only that, but all the beneficiaries be blessed by Almighty, the great success in their life, their career, in their final MBS examinations, in NEET examinations, and in their post-graduation in the future. With that good hope, let us start. The community medicine, definitely, it links you with the community. It is not the medicine in the classroom, it is not the medicine in the hospitals, it is different. Basically known as a public health, where the focus was gradually moving in those mid-19th century days, when everything was in shackles. There was no sanitation, no pure water, and the industries were growing on. The slums are coming on in the Europe and other countries because of the industrialization and urbanization. In those days, the concept of public health, the good of the public, started taking some momentum. And because of that momentum, gradually people learned that if the air is pure, if the water is pure, if the food is good, then public health, the health of the people, will be better. This is the basic concept. We do not think about individual health. We are thinking about the community health. Though the community health can only be achieved through individual health. That's why both components go with each other. But when we talk about health, again, people go with the definitions. I shall go very briefly that World Health Organization has defined health as a state of well-being. That means the person is feeling good, he is feeling better, he is fine with himself, and that state of well-being in three dimensions: physical, psychological, and social. All these three dimensions we will be talking about. It is not merely absence of the disease as the doctors and the patients think about. Number two, the patient is just the tip of the iceberg. We should not be focusing only on patient. Patient is definitely a god for the doctors. But one patient in the hospital means many a times that there are so many other patients who have not reached to the hospital. And they are in the community. Either we should reach to them or they should make to realize that they should go to the hospital. Three, those patients who are in the hospital may not understand that they should be getting treatment. And three, they may not be knowing that they are patients as such. Talking in the current scenario, say COVID, one patient of the COVID comes to the hospital, he is on the respirator, he is very serious and facing death. That patient has at least 10 other patients left out who are having sickness of the mild nature, only cough and some fever. And those 10 patients may be infecting many others who are nearby in the family, etc., who may not be at all having any symptom or sign. So this is the actual picture for any disease. The disease starts with the introduction of an agent, generally an infectious agent like bacteria or a virus in the body. Once it gets into a period known as incubation period starts. Incubation period is something where the body fights with the organism which has entered into the body. It takes some time, starting from several hours to several weeks. And after say 7 days or 14 days, whenever the incubation period is over, the person will start having some symptoms. Initial symptoms may be very mild. These may be known as the prodromal period. After that prodromal period, the actual sickness may compel a person to go to the hospital or to the doctor. The doctor treats him for several days. He looks at the laboratory investigations, looks at the other investigations and provides the treatment. After treatment for 2 days to 1 month or so, the patient may be declared cured by the doctors because he does not have the signs and symptoms. Laboratory says that he is all right. But then the next stage is known as convalescent period. Convalescent period is once the patient goes back after labeling by the doctor that he is okay, then this is convalescent period. Now in these phases, the importance of prevention lies first. When he is healthy, we must see that he continues to be healthy. Number one, please remember this. I shall be talking next time when we meet about the primordial prevention and primary prevention. Suppose he is not feeling well or has started symptoms which we know at the end of the incubation period is a prodromal period. In that period, we should start thinking about the screening of the patient for the early symptoms. If the early symptoms are identified and the treatment is provided, most of the times the life is saved. Once the treatment has been started, the patient leaves the hospital, we need to remember that sometimes even after leaving the hospital, the patient may continue to be infectious to somebody during the convalescent period also. Recall it back. During health, he needs to be looked after primordial prevention. He is healthy and he does not want to be sick. Number two, if he adopts the primary prevention where he can be taking vaccines, etc., or he may be protecting himself by helmet or belt in the car, this is known as primary prevention. The third one, when he leaves to the hospital, when he goes to the hospital, gets treated, early diagnosis and treatment, well, this is known as secondary prevention. All these preventive stages are very, very important to save the life. Our ultimate aim is to save life. And prevention is always better than curing away. After secondary prevention, suppose the patient continues to be in the hospital, our objective changes. It changes to remove the complications or lessen the complications, stop the complications, prevent the complications, prevent the death. That's also prevention. Starting from promotion of health to the end of the, say, saving the life from the death, this entire range is known as the prevention. From primary prevention, secondary prevention to tertiary prevention. Even if a patient has become lame because of the polio, suppose he has lameness, or he has been affected with the TB and people do not like that patient in the family, such patients require rehabilitation, punasthapan, getting them back into their original job, in their original family life is also prevention, because any human being cannot live only with the body. They live with the mind, they live with the society, and they need satisfaction. The aim of the medical science is to provide prevention from the very beginning so that he continues to be healthy. 2, so that he prevents most of the diseases. Number 3, if he cannot, he is early diagnosed and treated very well as soon as possible and as much as possible. And lastly, to prevent all the complications, prevent the death. Mortality has to be reduced by any cost. Now again, when the aim is already there, we need to identify the vulnerable population. Who are the people who are very much at risk? For example, young children, say newborn child. That child requires maximum care. And the first preventive measure which the God has already given to him is breastfeeding. Suppose a child is breastfed by mother, we know that most of the conditions are taken care of, particularly infections, because mother herself provides some antibodies to the child through the breast milk. Mother provides some antibodies in her own blood through placenta to the child in the uterus. So this is the beginning of the prevention by Almighty. This is already designed. What we look forward now, at the age of 6 months, the child requires to be weaning, getting good food, nutritious food, and the change of the food, which allows him to have enough calorie, enough protein, enough minerals, enough vitamins, etc. My friends, it doesn't end anywhere. When he comes to adolescence, some psychological help has to be provided so that he doesn't collapse because of the stress which he feels because of the physical changes and psychological changes. Adolescent moves to the married life or the service life where he must be having several stresses. The importance of mental health cannot be taken up for granted. And once he gets married or somewhere, the social life begins, the family life begins. And there are questions related to family medicine. He may be perturbed with the small things, and he needs to be understanding that he himself has some role to play as a father, as a family head. If we make him understand all these issues gradually, these issues will be related to environment in which he lives, because any human being lives within the environment. Environment is something which surrounds us. It may be physical environment like house, it may be psychological environment like our parents, our children, our neighbors, our friends. It may be a social environment like our state, our nation, our society, our caste, our world. Or it may be a spiritual environment so that he may feel bliss within himself. Whatever it is, the ultimate aim is to keep the individual healthy in all 3 dimensions as much as it is possible. Is it possible? Can we do it? The lectures to follow will definitely tell us. But before that, determine within yourself several things. Number 1, I want each and every student of mine to follow the preventive measures. Which are the preventive measures? First one, keep yourself healthy. How shall I keep? Take proper food, no junk food. Take proper exercise regularly for a long time and with definite confidence that you will continue for the lifetime. Exercise is not a one-day job. It has to be continued for the lifetime. Good food, good exercise, good rest. At least have 7 to 8 hours rest every day. Do not feel panicky about any situation. Try to overcome any hurdle if you have. Get the advice of somebody who knows better about it and feel confident within yourself. That's the way in which my own friends who are students will go ahead. That is primordial prevention. If the chance permits, have some protection. Protection in terms of the masks, protection if mask is not available, then a handkerchief, dupatta, whatever it is, for airborne infections which are current scenario of the COVID-19. COVID-19 is only current scenario, but otherwise also these habits of covering the mask while sneezing or coughing will definitely help keep the society very healthy. Next one is, we are generally dealing with the water which needs to be purified. The old habit of boiling the water, cooling it and then taking it was wonderful. But every time suppose it is not possible, the simplest way of disinfecting water is chlorine tablet. Even a layman knows nowadays. My dear friends, we are not going to talk very hi-fi, because hi-fi may not be advocated in a common man. The general public does not understand much about that. So simpler things, simple life, healthy life should be the message. Similarly, the population is growing on. So for the coming sessions, what will be our criteria to go ahead? Number 1, to understand more about primordial prevention and primary prevention, then to come to the secondary prevention, and then to come to the third prevention, tertiary prevention. These steps will be understood in details. Number 2, the environment. We must understand environment, because as a doctor we understand the patient, we understand the human being. But about environment of the hospital we are knowing something. What about the outside? How can we have pure atmosphere outside? How can we help ourselves and the community at large? That's the second point which we will be dealing with. When we look at the noise pollutions, radiation pollution or light effects on the individuals, then we realize that the issues are now newer. The mobile uses by the youngsters, by the small young kids, etc. The new issues are coming up for prevention. Generally, Everything is under the gamut of the epidemiology. The word is very important to understand today. Epis is about, demos is people, and logos is knowledge. If we know about whatever is happening to the people and try to understand particularly for the health issues, we can be helping them out to do something for themselves. Please remember, in preventive medicine, the person goes to the community to give them message to keep themselves healthy as far as it is possible. 2. In clinical medicine, the patient is sick and comes to the hospital. This is the difference. 2. Even if we do not go to the community in person, nowadays the technology is available. As I am talking to you, we can go to them by mass media, we can go to them by the health education sessions, we can address the large masses and provide information about the current scenario of health equipment available with us. All these things are very, very essential for keeping the nation healthy. This word stands very, very, very important to me. Nation must be healthy. A nation healthy means an individual healthy. An individual healthy means he is physically healthy, psychologically healthy, socially healthy, and spiritually happy within himself. If these subjective indices are also taken together, then only blood pressure measurement will not be our idea. We will be talking to the holistic person. The entire human being comes to us. Last but not the least, before I end up, please remember, whenever the patient comes to us, he is not a patient. Generally, we look at the liver, a kidney or heart. My dear friends, if we cultivate a habit to look at a patient as a human being, he is a father, he may be a child, he may be a son, he may be a husband, he may be a head of the family. He has his own responsibility. Looking to that patient in that particular dimension will help us to be a better doctor. And last but not the least, very important is, we need to study his face, his emotions, his feelings. Suppose he is very illiterate, we will talk in his own language. This is the basic of the preventive and social medicine. Suppose this happens, our classes which we are doing on this video will definitely help us. In the following classes for the next several weeks, I intend to take the classes under the Vasudev Institute of Comprehensive Health and Research. This is VICHAR, VICHAR. Under this VICHAR, this is an idea. I do not know how far it will go, but suppose you are comfortable with me, kindly continue, kindly subscribe to YouTube. My channel is Vasudev Rawal. Today we have just talked about the primary, secondary and tertiary prevention with primordial prevention. We have identified 3 dimensions: physical, psychological and social dimensions of health. And we have tried to generate a sensation that we should look to the patient, beyond the patient, outside the hospital, in the community. We look in the patient, a human being. If that is done, most of the things will be taken care of. My own student will not be sick. His family will not be sick. They will keep healthy. They will generate healthy habits. And of course, they will not have bad habits like tobacco smoking or alcohol. And then we will be actual preachers of health in the community. One who preaches and doesn't practice, he is not a good preacher, my dear friend. That's why I wish a long life to you. I wish a healthy life to you. I wish your career to be the best amongst all. I wish the India to shine like anything in the globe, and through you we will convey the community the best messages of health. I have no doubt about that. Next time when we meet, next time is next Tuesday, whatever is the date. On that day we shall be talking about the details of the prevention, particularly the natural history of the disease, the different types of the environments, and how can we tackle the issues related to the prevention of the disease. Till that, I say goodbye to you. Thank you very much for being with us, and continue to be with me. And your suggestions, your comments, your questions will help me learn. I am a learner also. A teacher continues to be a learner till he is alive. And my dear friends, I would like to enrich myself with your questions, providing you answers provided I know. Otherwise I will also study, because the knowledge is a very vast thing. We need to study every moment. Thank you very much again being with you. Good day. Goodbye.